Welcome to the Okayama University Japan Times SDGs Virtual Global Circuit Academic Seminar organized by the Institute Global Human Resource Development. I am Dr. Nobuyuki Kambara, Professor of the Institute, and I'll be your host. This webinar series covers topics related to Japanese culture or the United Nations Sustainable Development Goals, or sometimes both. We hope the broad range of topics will appeal to a wide audience and generate discussion and new ways of thinking. Let me address a couple of technical issues before we start. There will be a time for questions at the end of the presentation. You can ask your questions two ways. You can unmute your microphone or you can type your question into the chat function in Zoom. Please keep your microphone muted until the end when the question and answer time begins. Please be aware that there is a function called Q&A. However, please don't use that one because we will be only checking the chat function. Also, please select all panelists and attendees in the drop box of your chat function. This way, everyone will be able to see the questions that are being asked. It will also make it easier to understand the context of the answers that are given. Tonight's presentation is about COVID-19 and public health policies in Japan. Our speaker is Dr. Takashi Yorifuji. Dr. Yorifuji is a professor in the Graduate School of Medicine, Dentistry, and Pharmaceutical Sciences at Okayama University. At this time, I'll turn it over to Dr. Yorifuji. Yorifuji 先生、よろしくお願いします。ミュートされてます。よろしくお願いします。
そう、喋っていいんですか? So, hello, this is Takashi Yorifuji from Department of Epidemiology at Okayama University. So, I want to talk about COVID-19 situation in Japan. So, I hope you can get some useful information from my presentation. So, can I share my presentation?
Yes.
Can you see my presentation?
Yes, we can.
Okay. So today I want to talk about COVID-19 and public health policy in Japan. But unfortunately, I prepared for during I prepared for this presentation. I noticed that it's difficult to explain public health policy in Japan. So today, mainly I want to talk about the current situation of COVID-19 in Japan and also our local place, Okayama Prefecture. So my name is Takashi Yorifuji from Department of Epidemiology, Graduate School of Medicine, Dentistry, and Pharmaceutical Sciences, Okayama University. So basically, as you see, basically I'm an MD, a pediatrician, so child health doctor. And also I'm an epidemiologist. And mainly I conduct research on kind of environmental EP, so related with epidemiological studies related with environmental health, air pollution, or methane mercury, or arsenic exposure. And also because I'm a pediatrician, I conduct research on child health epidemiology or epidemiology in general. So at the beginning, I should say that I'm not so familiar with the terminology related with infection. So because because I'm a pediatrician, and I'm an epidemiologist, but my major is not infectious epidemiology. So I'm sorry. First, at the beginning, I should say I'm sorry. I'm not so good at explaining just such topics in English. But I want to try my best. So at first, I want to define that epidemiology. Epidemiology is the study of the distribution and determinants of health-related states, including disease, and the application of this to the control of disease and other health problems. So, by using epidemiological method, we describe the disease distribution. In this case, we describe the distribution of COVID-19. So we say it's a kind of descriptive epidemiology. You use information on time, place, person of the disease. We guess how the disease transmitted, or where the disease had happened, or who had the disease. So we use these kind of information related with time, place, person of the disease. We want to stop the disease, or we want to identify the causes of disease. So this is a kind of example of time information. The occurrence of, this is the case of E. coli disease in US, and also this is a kind of the time mapping of the Metsumaki poison in Japan. So using this kind of information, also I want to describe who has a disease. So using this kind of information, we try to cut the transmission of the disease. Also, we want to know the causes of the disease. So this is today's contents of my presentation. So the first, I want to explain the COVID-19. I think all of you know, but then I want to explain the current situation in Japan and current situation in Okayama, and I want to explain our activity related with COVID-19, and also future direction and summary. So I think all of you know, but I want to first explain the COVID-19. So COVID-19, there are actually already 6 coronavirus diseases. So 4 common disease, 4 common kind of 4 coronaviruses, which cause common cold, and also MERS and SARS, and this is the 7th coronavirus disease. This is a SARS corona. We say SARS-CoV-2 coronavirus disease, and which is caused by SARS-CoV-2. So this is a so sorry. So this is a coronavirus, COVID-19, SARS-CoV-2. And so first, I want to explain the situation of by WHO region. So now we have this kind of confirmed cases of COVID-19, and we have 2 million deaths already have. But the damage in our region, Western Pacific, is very minimal. So as you see, we have minimal. I think our region is minimally affected. We have a minimal cases of the death. So this is how to say, WHO publishes the information of total per 100,000 population. So in US has about 150 number of deaths per 100,000 population. But for example, in Japan, we only have 6 deaths per 100,000 population. So about 120 or kind of. So we can say that Japan, or our region, is minimally affected by the COVID-19. And this is a kind of very common symptoms of COVID-19. And if you usually, the symptoms appear 2 to 14 days after exposure to virus, and means I think the mean time will be around 5 days. And they have the infected person have cough or fever or chills or muscle aches or vomiting or loss of taste or smell. So this is common symptoms of COVID-19. And older people and also people with several these kind of medical conditions are at increased risk. So like, example, severe, for example, deaths or people who are at increased risk go to kind of be hospitalized, or so these people have increased risk of the worsening of the disease. Then, so how COVID-19 spreads is usually this is Japanese, but this is infected person and this is healthy people. So usually COVID-19 spreads through respiratory droplets. So this is respiratory droplets, but in specific setting, particularly indoor or crowded and inadequately ventilated spaces, aerosol transmission can also occur. So we should, I would say, have space, or we should ventilate. And also, touching contaminated surface can also occur. And for example, healthy people touch contaminated surface and then they touch eye or nose or mouth, and they can be infected. So this is three routes of the transmission. Also, one thing we should note is that when the infected person transmits the disease, is that infected people appear to be most infectious just before they develop symptoms. For example, namely 2 days before they develop symptoms. So it means that asymptomatic people or people who don't have symptoms can transmit the disease, the virus. And also, someone who never develops symptoms, so asymptomatic patients, can pass the virus to others. So because of the two facts, we should wear a mask anytime. So it's a universal masking. This is the reason why we wear a mask anytime. So according to the CDC in US, so how to protect yourself and others include wearing a mask and washing your hands often. And also, because as I explained that aerosol transmission can occur, we should have, for example, stay 6 feet away from others and avoid crowds and avoid poorly ventilated spaces. So these are important things to protect yourself and others. And also, not to infect others, we should monitor our health daily. These are very important things to keep, not to prevent infection to others. So I will move to the current situation in Japan. So this is a current situation in Japan and number of positive cases in Japan as of February 25, 2020. Now we have about 400,000 cases, and we have a first wave in April and second wave in August or July. And also now we had a third wave in December and January. So now the number of patients is decreasing in Japan because of several regulations against the virus disease. But this is a number of deaths, cumulative number of deaths, and now we have around 7,000, more than 7,000 number of deaths in Japan, and it's increasing. And usually now we have around 75 increase in deaths per day. And this is the number of severely ill patients as of February 25, and following the waves of the number of patients. So we have a first wave, and we had a second wave, and now we had the third wave of severely ill patients. Now it's decreasing. So I'm sorry, this is very busy slide, but so we collect the information, and according to, this is information from Ministry of Health, Labor and Welfare in Japan. And as you see, for example, this is number of deaths according to the age category. So as you can see, we don't have any deaths from, for example, children or younger people, but we have many deaths among elderly people. So it means that COVID-19 can affect severely elderlies and not children. And also, as I explained, using the CDC information, for example, this is a underlying disease at risk of increased severity. So, for example, if we have diabetes or obesity or cardiovascular disease or kind of pulmonary disease or hypertension, they have higher risk of my severity. And also, this is kind of, this is the information regarding the risk according to the age and compared to the people at age 30s, so who are elderly have higher risk of death severity, and the children or younger people have less risk, fewer risk of increased severity. But now, I'm sorry, I will skip the treatment, but now we can, how to say, improve the survival rate of patients. So, for example, this is a severe cases, that before June 5th, for example, we have about 30% of I think deaths after hospitalization among people at 70s. But now it's improved, and we have about 20% of deaths among severe patients at 70s. So now, I would say we can, because of several treatments, we can improve our survival rate of patients. So because of these information, or because of several, I would say, of course, the several knowledge, the ministry also recommends wearing a mask or hand washing or and also avoid we say 3 C's, and we should avoid closed spaces or crowded places and close contact settings. So this is very similar with CDC, as I explained before. So this is, I think, important message from Japanese government, also the CDC in US. So we should wear mask and wash hand, and also we should avoid kind of very crowded place or closed place and close contact setting. And also we should avoid going out if we have cold symptoms. So these are very universal, the very common message from the government, I think. And we should keep these information not to transmit a virus to others. And Japanese government also recently introduced 5 situations that increase the risk of infection and social gathering with drinking alcohol. So it's very difficult for us to drinking recently. And also, so we should talk in large groups, or conversation without mask, or so we should keep we should, for example, living together in a small limited space can increase the risk of infection, or switching locations. We should, for example, they are now smoking, but so these kind of 5 situations the government said that these 5 situations increase the risk of infection. So as you see that these situations are without wearing a mask. So the important message of this poster from our government is that we should wear a mask, and we should I would say, the situation without wearing a mask can increase the risk of COVID-19 transmission. So this is, I think, that's very similar message from the CDC or WHO or other countries, I think. Because of these kind of regulation, of course, we do several regulation. Restrict moving, or closing, how to say, restrict drinking outside, or because of the severe regulation, now we can decrease the number of patients. But because I think we cannot continue this kind of restriction, so that I think I will probably the number of patients may increase later, kind of this April or May or something. So because of these kind of restrictions or kind of wearing mask or precautions like such as wearing a mask or washing hands or keep distances from others. So I want to introduce the effects of these kind of precautions on other diseases, not COVID-19. I think this is slightly useful, I think, information. So, for example, this is mortality from January to July in Japan. So this is 2018 or 2019, and this is 2020. So as you can see, so in 2020, so compared to 2018, 2018 has 100%, is 100%. So compared to 2018, so certain infectious and parasitic disease decreased in 2020. And also this is interesting. So disease of the respiratory symptoms. So this is, I'm sorry, deaths in Japan. So number of deaths decreased in 2020 regarding the number of deaths regarding disease of the respiratory symptom decreased in 2020, and influenza or pneumonia. Yes, so as you can see, so because of several regulations against COVID-19, we could decrease several infectious diseases or influenza and pneumonia. So this is, I think, interesting impact on other diseases of the precautions against COVID-19 in Japan. So this is influenza infection. So influenza. So this is a 2000. These are kind of, this is 2021, and I think this is 2020. But compared to other 8 years, so the number of influenza infection decreased dramatically. So we don't actually. I sometimes work as a pediatrician, but I never see influenza children infected with influenza this year. So it's very interesting. And also, this is a gastrointestinal infection this year. So compared to other years, so the number of patients with gastrointestinal infection decreased in 2020. And also, chickenpox. Chickenpox usually transmit by via aerosol transmission. So compared to other years, chickenpox also decreased this in 2021. So these kind of how to say precautions against COVID-19 also decrease the number of deaths related to infection in Japan. Also, the incidence of several infectious diseases in Japan. So this is very interesting situation because of regulations against COVID-19. But unfortunately, because of several regulations, this is information from my area, Okayama City. So this is the emergency number of emergency dispatches from March to August. So I mean, it's a kind of ambulance call. So because of several regulations, I think the number of emergency dispatches decreased in 2020. But number of emergency dispatches due to self-harm, so I mean the committing suicide, increased this year. So I think this is very, I'd say, sad story, but probably because of the regulations, and we will check detail. So, for example, after we restrict only the people who conducted self-harm, so as you see that the people who are at ages from 25 to 49 years old have committed suicide this year, and also women committed suicide this year. So this shows that probably because of several regulations, people lost their jobs, or people should, how to say, experience very stressful situation. So this may affect the working generation and women. So probably the COVID-19 regulation may have good effects on, of course, COVID-19 and other diseases related with infection, especially. But it may affect economics and it may affect increase the such how to say the mental problem or mental health. So this is, I think, very important problem and we should check. So this is also, I want to explain briefly, but this is the kind of this. This is the situation in Okayama. Okayama is a small prefecture, and we have around 1.8 million people. And so we also have a first wave had very small, but had a small first wave in April and the second wave in July and August, and we had a third wave in January or December and January. But now number of the patients decreased, and this is the same. But I show that the number of patients from November to February, but as you see that number of patients is decreasing recently. So, because I introduced COVID-19 and current situation in Japan and Okayama, so I want to talk about our activity related with COVID-19 in our prefecture. So this is the characteristics of COVID-19 transmission. So for example, influenza. Influenza, one, as you see, one infected person infects one or more people. So, but COVID-19, usually the COVID-19 patients, as you see, for example, you can read, but regardless of illness severity, 4 out of 5 infected people do not infect anyone else. So the remaining one, this one, infects someone else, and even severe minority infects multiple people, leading to the formation of clusters. So we say, compared to influenza, so COVID-19 can cause or generate or make clusters of patients. So we should deal with such clusters. So in Japan, for example, in many countries, I think they prospectively tracing infected person. So, for example, when a case is newly confirmed, close contacts are identified and monitored for symptoms. But in Japan, we retrospectively are tracing the patients, and we want to we want to identify common sources of infection, and we want to do some I would say to some regulation on common source of infection, and we want to how to say cut the transmission of disease. So this is kind of as a strategy we do in Japan. So we in our prefecture we have to deal with such problems of COVID-19. So like COVID-19 can make or generate clusters. We now have a team in Okayama. We say it's a Okayama COVID-19 cluster investigation team, OSIT. And this is a team to deal with clusters in, for example, facilities such as hospitals or facilities for elderly or nursing home. And we provide advice for infection control or conduct epidemic studies and provide medical support. And of course, to suppress the clusters in such facilities. I think this is very unique activity we conduct in Okayama. Sorry. So I'm sorry, this is in Japanese, but for example, we say it's a OSIT, and if our clusters occur, so probably public health center is notified the occurrence of clusters, and then public health center asks the Okayama prefecture to help, and Okayama prefecture and our department discuss. Then we dispatch several teams to the clusters. For example, ICD means infectious control doctors, so that doctors who specialists regard who are specialists on infections, and this is a ICN infection control nurse, and this is epidemiologist, for example, like ours, and we provide medical support for the team for the clusters site, and then using these kind of groups, we deal with the clusters problem at the facilities and try to cut the transmission or to suppress to try to cut the transmission and also to support the patients at the facilities. So for example, I will introduce an example of a large cluster in Okayama Prefecture happened in December 16, 2020 in Okayama. So like, for example, the cluster had around 69 cases of COVID-19. So, for example, the nursing home had 38 patients from elderlies, and the nursing home had 21 patients from the staff. So this is a picture of the facility. So they had a cluster in Okayama in last December. So we went to the site and conduct epidemiological studies, or so this is a conduct epidemiological studies or give advice for infection control, or provide medical support for the patients living in the facility. So, for example, this is a we say it's a kind of epidemic curve of the patients. And for example, this is from December to January, and this is number of patients. So as you see that the the facility had around 20 cases in December 18 or 19, and so we dispatched a team to the site, and we conduct several interventions, and then after that we could, I would say, cut the transmission, and we could decrease the number of patients. So this is the onset of the disease. Yeah, this is confirmed case, confirmed dates, and this is a onset. So I mean the symptom onset dates. So after we conducted several interventions, we could decrease the number of people who had symptoms. So I think this is a kind of a success of our team, I think. So using this kind of information, so for example, we could say that the facility user had a symptom at the beginning of kind of in the I would say January 10th or 11th, and it could cause the clusters. So using this kind of epidemiological information, we try to, how to say, using this kind of epidemiological information, we, how to say, we try to suppress the infection at the site. So this is a picture from the site, and they, for example, their members are cleaning the rooms, or this is a medical doctor who treat or who observe the patients at the site. And also he is an ICN, some infection control nurse. And so he was giving advice for the staff at the facility. So also he was giving advice. And he's a medical doctor. He was checking kind of the health status of the patients in the site. So using kind of using kind of team like epidemiologists or medical doctors or nurses, we try to suppress the epidemics at the facilities. So this is a OSIT team we have in Okayama. So the recent topics we have in Japan is variants of the COVID-19, and we now the cases of the variant cases are increasing in Japan, so it's a big. Yeah, so we have a concern that the variants may increase number of patients. Also, now we started the COVID-19 vaccine, so but it's still limited. So we hope that the vaccine can contribute to the decreasing of the patients. So so this is Japanese, but if you are Japanese, please check our department information, and we introduce several information. And yeah, so I'm sorry because there is small presentation, but my conclusion is that Japan and Okayama prefecture, our prefecture, experienced the third wave of the COVID-19, and I have a concern that number of patients may increase in this the end of March and April, because the several regulations were, I would say, because of the people moved in this April, people may move this spring, so number of patients may increase. I have concern that patient may increase this March and April. So we should keep, because the situation is improving in Japan and probably in other countries, but we should keep protecting ourselves and others. So the important message from my presentation is that the ways to protect ourselves and others is wearing a mask and wash hands and stay 6 away from others, avoid crowds and avoid poorly ventilated spaces, and we should monitor our health daily. So I think this is the how to say universal precautions we should take to prevent not to transmit viruses to others. Thank you.
Thank you very much, Dr. Yorifuji. Your presentation was based on the data, so I think it was very easy for us to understand your argument. Now we'd like to take questions from the audience. Please unmute your computer, and then you can speak, ask the question directly to the Dr. Yorifuji. No question? Okay, thank you very much, Dr. Yorifuji sensei. Your presentation was very easy to understand.
Thank you.
And it was very informative. And also, thank you very much for audience. I'd like to thank you, all of you. And I'd like to have you in the future web series, Dr. Yorifuji. Would you please come back again?
Thank you very much. Yes.
Thank you so much. Everyone have a great evening and good night. Bye.